Good afternoon, everyone. How y'all doing? I'm Allison Adams. I am representing today the Foundation for a Healthy Kentucky. And it's a perfect segue from your previous speaker in talking about data and how it can influence the healthcare delivery system in the state of Kentucky. The mission of the Foundation for a Healthy Kentucky is to address the unmet health needs by developing and influencing policy. We also are interested in reducing disparities in health risk and then promoting equity. And so I want to talk to you today about unleashing the potential of healthcare data and what it can do to influence our health outcomes in the state of Kentucky. So you've heard a couple of presentations today for those of you who are with the morning session and you just heard about technology, that data can play a pivotal role in anything that we do in the future today, what we learned about it in the history, and it's not any different when we talk about improving the healthcare delivery system. It can enhance patient care. And what do I mean by that? When we look at the data, we can follow the person from the continuum of care. You might have heard of some of the data that we already have, and we might not be using it as well as we think we could. And so when we think about what reviewing the comprehensive set of the healthcare delivery system, we have to look and see what we have access to. And Kentucky has a couple of gaps in that, and I'll talk a little bit about that in just a minute. But we also want to think about improving cost efficiency. You all know that we have a great amount of our gross national product is utilized in paying for healthcare. And it's no surprise to anyone that Kentucky and the United States as a whole is not doing very well in our health outcomes when you think about how much we are spending. And so when you had that comprehensive review of the data, you also can identify where those cost efficiencies are. And when you think about that, we are also talking about low value care. Do we need to spend a lot of dollars on care that's really not producing the outcome that we're looking at? And so having a data review also will identify low value care. It also informs research. We know that when we think about treatment, when we think about medication, when we think about other modalities and homeopathic care, what is the data really telling us about the outcomes? Is it improving? Is it having any impact at all? And especially, what is the cost? And finally, what's most near and dear to me is how do we use data to impact policy? Policy, big P policy, small p policy. What does that look like at the local level, at the business level, and of course at the state level? And we want to know that what the data tells us. Just having any old policy and hoping that it works, we know isn't an efficient use of time or our energy. And so when we think about what that data can tell us, we want to know, is this policy going to be effective? And also think about what policy means in directing dollars. When we think about what Appalachia is facing in healthcare and healthcare outcomes, having a comprehensive data system can help direct healthcare dollars to the issues in which we know Appalachia are plagued with, are suffering from. So from our perspective at the Foundation for Healthy Kentucky, we see that there is a lack of, or could be, the data that we have could be augmented with claims data, which is absolutely missing in the state of Kentucky. It's available in 22 other states. And so I'm challenging you to think about what you could do if you knew, or what benefit you could have if you knew what the cost of that healthcare, overall healthcare was in the state of Kentucky. We know that we have hospital utilization data. We know that we have some pharmacy data. We know that we have Medicaid data, Medicare data. We have all kinds of data out there, but right now in the state of Kentucky, it's very fragmented and uncoordinated. And so the Foundation for a Healthy Kentucky is looking to help inform policy by moving Kentucky into a coordinated approach that has all the data sets that we need in order to have the best information to inform what we need to do to improve Kentucky's health outcomes. Filling the gaps is challenging. A lot of folks aren't really interested in sharing information or having their information shared. We also know that there's a challenge in the healthcare system of who's paying for what service, where's the money coming from, is it public, is it private, is it commercial? We know that there are challenges. And we spent the best part of this year, and hopefully in the near future, Kentucky will benefit with a comprehensive healthcare data system in which policymakers, research, business owners, local leaders, philanthropic organizations can utilize that data that brings the groups and the people together to say, this is where we have gaps in our system, this is where we can impact policy, and this is where we can expect that outcome. We can expect that if we do this based on the data, we will have a better health outcome into the future. So from our perspective, we understand that we know what the problem is. I hear, we know what the problem is, Allison, but we don't know what to do about it, or nobody's doing anything about it. And I just want to challenge you to think today and join your policymakers and your other health organizations who are interested in improving those outcomes, driving that outcome through the use of data, to think about this. We know what the problem is. We can identify the problem, but we haven't defined it. And we also haven't got a good direction to the solutions. A comprehensive database that includes claims, what it's costing the healthcare system, defines our problem, and it points us towards the solutions. Thank you.